For a sterile no-touch dressing change, you will need a dressing tray kit, abdominal pad, extra 2x2 and 4x4 gauze, clean gloves, hand sanitizer, clear tape, Me-Fix fabric tape, Q-tip or measuring device, and sterile water or saline. First, perform hand hygiene. Then apply clean gloves and carefully remove old dressing. Pull tape towards center of wound. Make note of the wound as well as the amount, type, and characteristics of drainage. Fold dressing into glove and dispose. Then perform hand hygiene. Now, open sterile dressing tray kit. First fold away from you, then side folds, and if included, use forceps to assist you in opening the last fold. Then square sterile field on your table, and remember the 1-inch non-sterile border around your field is to place the grips of tools. Have the tips of the forceps inside the sterile field. Now add extra supplies to your sterile field if needed. Use sterile forceps to add supplies. Now organize your sterile field supplies. To add sterile water to the tray, take the cap off the sterile bottle, squeeze the first bit of fluid into the garbage, then carefully add it to a section of the tray. Now open the garbage bag if included and place in an easy-to-access area. Next, the wound needs to be cleaned. Take a 2x2 gauze and soak it in saline. Wring out the excess fluid. Hold the gauze by folding the corners into the middle and pinch all 4 corners with a forceps. For saline-soaked gauze, fold it in the plastic tray. For cleaning, 1 swipe, 1 way, 1 gauze, starting with the farthest wound edge, then the opposite edge, and then the middle of the wound. Then it's time to dry. Take a dry 2x2 gauze and dry the wound. 1 swipe, 1 way, 1 gauze, starting with the farthest wound edge, then the opposite edge, and then the middle of the wound. Now, apply the new dressing. Some doctors will prescribe a certain dressing to be used, and some units are limited to the type of dressing supplies in stock. In this case, a dry 4x4 gauze is folded in half and placed over the wound. Then an abdominal pad is placed over top because there's increased drainage. Blue line faces up on the abdominal pad. For securing the dressing, Me-Fix fabric tape is used to tape down the edges of the dressing to the skin. Apply clean gloves if needed. Time, date, and initial the dressing. Then cover the patient, clean up supplies, and perform hand hygiene.